Imagine if you had a 4 to 10 times higher chance of dying, but you didn't know when it would happen. But when it does happen, it leaves you either off to the hospital or you're just unconscious. And if you do regain consciousness, maybe you can't speak, maybe you can't use one of your arms, maybe you can't use your legs, or maybe you're just gone. That's what the fear of AFib is like. An AFib is really a ticking time bomb for people. And yes, luckily there are advances in medication and other ways of monitoring. But AFib by itself, and then when you also combine that with sleep apnea, it becomes very troubling to go about your life. Because not only what I just mentioned, but also, let's say you're on a blood thinner. Nothing in medicine is perfect. And now you've increased your risk of bleeding out, the opposite of the problem. That's why a lot of times when you look at medical guidelines, past a certain age, when people are more likely to have a fall, you don't want someone like that to be taking blood thinners. So it's important to understand how these conditions come together, and especially how sleep apnea can really lead and honestly cause AFib, known as atrial fibrillation. And fibrillation is just a very fancy way of your heart, instead of it contracting fully, it does this fluttering and it actually doesn't get enough blood out. But there's a more sinister problem when that happens. Talk about that in a little bit. So first, obviously, I am Dr. Dylan Peckus, and today we're going to talk about sleep apnea and AFib. And for the sake of me mispronouncing fibrillation time and time again, because I'll say I have fibrillation or something crazy like that. It'll happen. I'll just say AFib. All right. And what you want to know as we walk through this, because we got quite a few great things. I hope I didn't make anyone dizzy just then. But there's a huge link between these two. And like I alluded to, when you have AFib, this is going to increase the risk of stroke by itself. There's other things that will happen, like say a pulmonary emboli or blood clot in your leg. Those are also nasty and life-threatening. Stroke is just one of them, and if you have AFib, that's going to increase the risk of having a stroke by 5 times. And these are very closely related to one another. So let's say you don't have any heart conditions, and now you have sleep apnea. You are 4 times more likely to have that than someone without sleep apnea. And how the numbers actually shake out is that of 10% of people who have obstructive sleep apnea, they have AFib. And people who have AFib, 50% of them, I've seen some estimates of 70 or 80%, but 50%, which is conservative and probably accurate, they have obstructive sleep apnea. So there is a big link here. And again, it's very important to know because AFib is no joke. Like I mentioned before, what happens when your heart is in this mode? Think of it as your heart as something that is designed to squeeze out toothpaste. Stick with me because your heart is meant to squeeze together and pump out blood. And this very like pump it out, it goes out. Pump out. Same thing when you use your toothpaste, right? You apply pressure and it squirts out a certain amount of toothpaste. It's a little bit of a gross analogy, maybe, and you'll think about your toothpaste a little bit differently. But think about it like this. If you try to get toothpaste out of the tube just by like lightly tapping it from a bunch of different sides with all your fingers, it's actually not going to come out. That's what a heart does when it's an AFib. Instead of having this very synchronized contraction of muscles, it's all over the place. Okay, not like full blown when someone's having a heart attack. It's just in the atrium of the heart, which is just certain chambers of the heart. And then what happens is when you're having that go on, the blood is becoming stagnant. It's not moving, just like the toothpaste in the tube. Now, toothpaste is going to be toothpaste, whether it's in the tube, out of the tube, unless you use it and all that. When blood sits around, that causes problems, and that's when coagulation happens. When blood goes from more of a liquid and it condenses into more of a solid, or really more gelatinous, really, if you've ever seen a bunch of blood clots. And then this will lead to a lot of bad things, because this diagram, which is a little bit grainy, but nonetheless, you have a blood clot form in one of the chambers in your heart, and then it goes off to your brain. And then it will get stuck there and then pretty much choke your brain off of oxygen. That's not good. So if you're here, chances are you may have AFib. You may be wondering if you do. So just some warning signs to look for if you have AFib. It could be your heart skips a beat, or you just kind of feels like it just feels like a very lifting sensation in your chest when you have a skipped beat. Or you might have some fluttering, you might have some dizziness that's not for really a reason you can pinpoint. Chest pain is an obvious one, breathlessness, and of course just fainting is going to be another one. So any of that happening to you, make sure you're talking to your doctor about AFib. All right. And the reason AFib happens at a physiological level, and then we'll talk about how the heck sleep apnea leads to AFib. Okay, don't you worry, we'll talk about that. But just to know, AFib is when the electrical activity of the heart is just not synchronized. So instead of being this very easy, harmonious transfer of electrical activity, or just things firing off in the right sequence, like it should in the normal heart, the electrical activity or the firing of this signal is just all over the place. And that's when, instead of contracting all at once in the atria here, these are the top chambers of the heart, it's just kind of different parts of the atria are contracting, as opposed to all together in one concerted action. And as a result, blood's not moving, it's stagnant, clots form, bad stuff. Okay, that's why when you look at an ECG or EKG, however, whichever country you're from, you're going to see this difference in electrical activity. And it's really important, beyond what we talked about, right, of obviously the deadliness of this condition, but also there is this two-way dynamic relationship. So if you look at this chart, AF stands for AFib and SDB stands for, I'll let you guess, stands for sleep disordered breathing. All right, that's what SDB stands for. And pretty much when you, in sleep disordered breathing, let me expand on that, just kind of went right by it. Sleep apnea is a form of sleep disordered breathing. Okay. So AFib will increase your likelihood and make sleep disordered breathing worse, and sleep disordered breathing, sleep apnea, will make AFib worse. So when you have either of these, it's very important to deal with both of them. Now, in more cases than not, it's more of a, in terms of what kicks it off, is sleep apnea leading to AFib. Okay. Very rarely am I speaking with someone, knowing of someone or anything where it is AFib led to obstructive sleep apnea. Just doesn't really happen. And getting to the nitty gritty of this, I don't want to use all of our time and brain cells on that. It would be more useful to understand, well, how the heck does sleep apnea lead to AFib or increase your risk of getting it? So, obstructive sleep apnea, a lot of different things happen. And I almost want to start at this point in the diagram, this little central point of these autonomic nervous system fluctuations, or ANSF for short. I totally made that acronym up, and I don't regret it, but also I don't think anyone should use it. Just saying. I was just messing with you with, we already did SDB. But nonetheless, this ties into what I mentioned over here. You have this electrical activity going off. So when you have ANSF, when that's going wild, that is going to lead to different and bad electrical activity in the heart, like we see over here. You have it kind of all over the place. So this is the main point in which I was going to say SDB leads to ANSF, but I'm going to stop with the running joke. This is the main way in which obstructive sleep apnea will lead or precipitate AFib, is leading all to this one very common point. Now, there's a lot of different things with obstructive sleep apnea that will lead to that. We'll go through all of these here. One is going to be these arousals, these waking ups, whether it's you're waking up consciously or all the little micro arousals where like your body kind of wakes up, but like you don't either remember it or you're not conscious during it. Okay, just because maybe you only wake up like 3, 4, 5 times a night, when you have sleep apnea, if we did a sleep study and looked at your brain waves, you're waking up like 10, 20 times per hour. Okay, even if you don't remember it. That's why this is concerning. So that will then lead, because just like if you jolt your body open, because think about sleep apnea, you stop breathing suddenly for 10 seconds, and to kickstart your body back into breathing, your body will fire on its autonomic nervous system, the sympathetic nervous system. It'll fire that on to get a big breath out, that little gasp, or it may not always be a gasp, and that gasp does not need to wake you up. It could just be resuming breathing or snoring in a sort of gaspy way, if you will. That will trigger your autonomic nervous system. And then as a result, these aren't really separate, they're all related, just different mechanisms. So let's talk about gases first. Hypoxia. When oxygen goes down in your body, that goes down really fast and then it goes back up. That actually causes inflammation that then triggers your nervous system. And then conversely, when CO2 goes really, really, really high, then it will also lead to this. Out of the two, the more damaging one is the swing in oxygen levels. This is way more damaging just because oxygen creates free radicals, hence oxidize. That's where that word comes from. And then the other thing that contributes to this as well, because whenever you're having big movements of breathing, we tend to focus around like our noses, the noises, gasping. Also, as a result, our chest pressure, or if you were to think of our chest like this balloon, it's gonna like change a lot as this goes on. And as that happens, that is going to stretch and then compress the blood vessels, your heart itself, the nerves, and then that's going to lead to the activation of the autonomic nervous system. And as a result, it is like throwing a lot of current, if you will, onto the electrical circuitry of your heart. So think of it like this. AFib is when you have like every single appliance in your kitchen plugged in. You got the air fryer, you got the blender, you got the toaster, you got the what else can you have? The Mr. Coffee Pot. You have all that going. You have the dryer going. You have what's another big appliance? I need bigger appliances apparently. I can't think of them. You have the air purifier. You have all of them plugged in. Okay, I think you get the idea by now. And then you have those like shortages in electricity, or maybe things flicker. That's more or less what AFib is. And we won't get into like QT prolongation and all these other things and re-entry mechanisms. You just need to know that when this electrical activity is off, like it will be over here, and it's over here, then that causes more problems. And now let's kind of hone in on here. Then as this happens, those electrical abnormalities they start to become pathways that happen more frequently. Because the big difference between the electrical system in your heart versus the electrical system in your home is that in your heart, it will adapt over time so that some pathways become more frequent. So that's why if sleep apnea is happening at night, AFib will continue or have a higher risk of happening during the day because you are remodeling. That's what that is. You're remodeling the electrical system of your heart. Not good. And then at the same time, the other big thing. So, number one is that sleep apnea will throw off your nervous system and then throw off the electrical system in your heart. Simplest way to say it. Then the other thing is that these other factors, right, when you're having hypoxia, the arousals, you're waking up, and then also just like not getting sleep. Because if you're not getting any good sleep, inflammation goes up. And that's exactly what this cascade is about. You have inflammation, goes sky high, and then it leads to vascular dysfunction. And as this diagram may suggest, this is when the blood vessels and also the blood cells, etc., they will be more inflamed. They'll be bigger. And then also, all the little things that typically trigger blood clotting will be overactive. So, this will compound with the slowing down of blood in the atrium to lead to blood clots, like we've mentioned. So, that's why when we're talking about what the heck do we do to help with AFib, like obviously, yes, talk to your cardiologist, but the biggest thing is this one right here. Let me like mega zoom in. Obstructive sleep apnea. This will also happen with central sleep apnea as well. Just a diagram from a research paper for OSA, but it will happen in central sleep apnea as well. So that's why being able to target sleep apnea super, super important. So for example, one of our clients, we'll call him Tim. He has a pretty anonymous name anyway, but I'll give him a different anonymous name. Fella with AFib. And when you have AFib, if you monitor it, which you should, monitor AFib. Public service announcement, monitor AFib. Nonetheless, there's something called AFib density. It just means how often are you having AFib. And when we started working together, I think it was around 10 to 12, somewhere in there. And as time went on, he actually pretty quickly in a couple weeks started to see that go down. And then at a point where, all right, we're around like 2%. I think that's as low as his sensor senses. Usually they'll say less than 2%. And a big part of that has been because his sleep has been improving. Not perfect yet, but that's actually a good thing. Because if you can have that dramatic of a shift in how your heart functions in a relatively short amount of time, and you don't need to even fully resolve this yet, he'll get there. You're getting there, Tim, if you're watching. Um, but that's why it's so, so important to tackle this. Because then it takes not only the risk off the table, but also like your ability to break this cycle, right? Now, oh wow, now your sleep's better. And now you're not triggering AFib as much. And then you don't have to increase your risk by taking drugs and etc. Again, nothing wrong with drugs to manage things. We just always have to be cognizant and aware that there's going to be side effects. There always will be, right? But the more you can get to a good place where you don't have an underlying cardiac condition to deal with all the time because the thing that led to it is not causing all this stuff to happen anymore, that's what you want. Because not only once you get rid of this, your heart's doing a lot better, but also the other thing we haven't talked about, just like the general misery of sleep apnea. Feeling like you're just absolutely tapped out 24/7 and exhausted. And you add that on top of the looming threat of AFib day in and day out for you, what kind of a life is that? Not really much. Just isn't. So that's why being able to do things for your sleep apnea and also undo a lot of these problems is critically, critically important. So that's why when we're working with people, being able to calm down your autonomic nervous system. Really, really important. So one thing, and then this is your decision today to do something. Gonna give you something. Okay, you gotta do it. Promise. This is a pinky swear that you're actually gonna do something from this video. Okay? Because I watch YouTube videos and I don't do anything. Not today, my friend. Because if you have an opportunity to improve your health and do nothing, guess what? You get the same stuff day in and day out. All right? So, what you can do. One of the things, well, there's many things. Which way do I want to go? You want to have a way to reduce your stressors. Now, this may take many forms. This may be meditation. This may be doing breath work like I talk about all the time. It may be getting a HRV biofeedback, which honestly I would think would be the best. Do something to help your nervous system calm down. Because when you're stuck in a state of sleep apnea, it is very, very tempting to just keep pushing and keep going. That's going to drive your nervous system more and make everything worse. So you need to have something to counteract that in a big way. Because even just really honing in on this one factor, even before you resolve sleep apnea, that will do a lot to help with your heart. Okay. Is it going to completely turn everything around? No, you still got to obviously deal with the sleep apnea. I'm just saying for yourself, take that time. Like, are you doing things to reduce your stress? Because as not sexy as it sounds, I wish I had like a, ooh, here, take this supplement. You know, it came from Mars. But just doing something, whether it's just 10 minutes of breathing, that is going to do miles for you in terms of your nervous system. All right. So make a decision today. What is that going to be for you later today? Is it going to be, I don't know, finding some meditation thing to listen to on YouTube elsewhere? It is totally up to you. Now, obviously, there's going to be a lot of different factors that are going to be really something you want to target with making your obstructive sleep apnea a thing of the past. Now, what those things are for each and every single person, because you got to focus on your nervous system, you got to focus on your inflammation, and many, many other different factors. That really depends on you. Because, yes, being able to watch these videos or other videos by me will help you make progress. It just will. You will learn more. And in all those videos, I also bug you to do something. Okay? Maybe I'm a little bit pushy. Maybe I just want a better life and better health for you. I don't know. But nonetheless, that will give you a certain level of progress. And for people who want to be able to, do things by themselves and take that path where you're figuring things out, that's absolutely fine. And if you're someone who wants us to do a lot of the heavy thinking and help you solve those complex problems and identify those problems so that you are actually spending all of your time as efficiently as possible and being able to turn this all around, then what I would want to offer you is our free evaluation session, which you can go to ochnow.com/talk. So I'll zoom out so you can see that. And that's just a call where we connect and we talk about what are the major issues that you're running into, what are your goals, and how we can help you achieve them. And if we can, we'll walk through all those details. But if not, like if it's just a simple fix, I'll let you know. If it's pointing you in another direction, that's where the conversation goes as well. So all you got to do is go to ochnow.com/talk. And once you do, you will see this lovely form where you just answer a few brief questions so we can really hit the ground running in your call. Go ahead and go to ochnow.com/talk, fill out your form, and then pick your date and time, and we'll give you a call then. So thank you so much for watching, and look forward to speaking with you soon.